The first thing that I'd like to say is welcome. Welcome back, the 116th Congress under the new majority. And I want to thank my Democratic colleagues for supporting me to do this work, to chair the subcommittee. It is an enormous honor, and it is what is contained in the committee, of course, are some of the most important issues that the American people expressed at the polls in the midterm elections. To our Republican colleagues, I know that that there are areas where we can really work together. In some areas, we're going to have to stretch. But know that I look forward to working with all of you, and to those that are new members of the subcommittee, welcome to each one of you. I know that you're going to bring great ideas and really be instructive to the rest of us, so welcome to you. As I said, health care was the single most important issue to voters in the midterm elections. And it's a rarity that there would be one issue that would be the top issue in every single congressional district across the country. So this subcommittee is front and center. We're beginning the Health Subcommittee's work by discussing the Texas versus United States lawsuit and its implications for the entire healthcare system, both public and private. For over 100 years, presidents including Teddy Roosevelt, Harry Truman, Richard Nixon, and others attempted to reform our nation's health insurance system and provide access to affordable health insurance for all Americans. In 2010, through the efforts that began in this committee, the Affordable Care Act was signed into law, and bold reforms to our public and private insurance programs were made. Since the Affordable Care Act was signed into law, over 20 million Americans have gained health insurance that is required to cover pre-existing conditions. The law disallows charging sick consumers more. It allows children to stay on their parents' health insurance policy to the age of 26 and provides coverage for preventive health services with no cost sharing. Last February, 20 attorneys general and governors sued the federal government to challenge the constitutionality of that law. They claimed that after the individual mandate was repealed by the Republicans' tax plan, the rest of the Affordable Care Act had to go too. The Trump administration's Department of Justice has refused to defend the Affordable Care Act in court, and in December, Judge Reed O'Connor of the Northern District of Texas declared the entire ACA invalid. 20 attorneys general, led by the Attorney General from California, our former colleague, Xavier Becerra, have appealed Judge O'Connor's ruling. For those enrolled in the Affordable Care Act, if the Republican lawsuit is successful, the 13 million Americans who gained health insurance through the Medicaid expansion will lose their health insurance. The 9 million Americans who rely on tax credits to help them afford the insurance plan will no longer be able to afford their insurance. And health insurance costs will skyrocket across the country when healthy people leave the marketplace for what I call junk insurance plans that won't cover them when they get sick. Another implication, leaving the sick and the most expensive patients in the individual market, driving up premiums for so many. The insurance reforms of the ACA protect every American, including those who get their health insurance through their employer. Every insurance plan today is required to cover 10 basic essential health benefits. No longer are there lifetime limits. The 130 million patients with pre-existing conditions cannot be denied coverage or charged more, and women can no longer be charged more because they are females.